little thing with the, I think it has to do with Obamacare. The workforce going from 40-hour work week down to about the 29-hour. How are, we have 15 grandchildren. And some
Congratulations.
I'm worried about the future, future generations. How is that going to affect their work?
Yes.
And
This is the issue, it's a great question. And this is one, for those that aren't familiar with this, the way full-time employees are described currently in labor law is 40 hours plus. Part-time, 30 and under or under 40. But under Obamacare, they've called it 30 and under is part-time, 30 and up is full-time. This has created a situation where if you have so many full-time employees, then you must provide health care. And that's the gist of it. So some people now, some businesses, are determining that maybe we'll just hire our employees for 29 hours to avoid this issue, which of course means the income that they earn is going to be very problematic. There's a bill pending right now, Senate Bill, I think it's 1188, that is sponsored to partially fix this problem. I'm not on that bill yet because I think there's some other things we can do on this. I have met with the Chief of Staff of the White House as recently as last Friday on this issue, because I've been bringing this up on a regular basis, that this is a problem we need to fix and address. Because we sure don't want people to go from, say, 37 hours a week to 29 just because the employer wants to avoid the healthcare issue, and now this poor individual has less money. And maybe they're working at a $10 an hour job or a $15 job or even minimum wage. It creates a real economic hardship. I will tell you this from a conversation I had last Friday with the Chief of Staff of the White House. It was very clear as of that call, finally, I've had 4 meetings on this, plus a couple other issues around the healthcare, that he has indicated as of last Friday that the President clearly understands that this is a problem that needs to be dealt with. That is finally, we broke through a little bit. Now, what does that mean? That means we got to find a solution here that ensures still that we're making sure people get health care, because that's very important, but not at the risk of being economically depressed or economically reduced, wagey reduced. So it's a very tricky situation to fix. But there's a lot of us working on this, and I'll tell you, I've met with a lot of businesses, I do it on a regular basis, and this is the #1 issue they bring up around the healthcare issue. How do we fix this so we can provide health care, but also not have to put our people in a part-time status because we can't afford a plan? Sure that small businesses are empowered